At the American Academy of Allergy, Asthma, and Immunology's annual meeting in Washington, we spoke with Dr. Scott Sishurer, a pediatric allergist who is Associate Professor of Pediatrics at Mount Sinai School of Medicine. Dr. Sishurer is also a researcher at the Jaffe Food Allergy Institute.
So part of the good news for going shopping with having to manage a food allergy is that the current labeling laws in the United States are under guidelines that were established as a law in 2006. So the Food Allergen Labeling Consumer Protection Act requires that if there is an ingredient that is milk, egg, wheat, soy, peanuts, tree nuts like walnut, almond, Brazil cashew, fish or shellfish, crustacean shellfish like shrimp or lobster, then those have to be labeled in plain English on the ingredient label. It could be within the list of ingredients. It might be contains peanut and milk, but it has to be in plain English terms. So it should be relatively easy to find those. Now, the things you have to know about within that law is that it doesn't cover every possible allergen. So if your child is allergic to garlic, for example, that's not part of the law. So it's only the list of foods that I just mentioned that are going to be under the guidelines of the law to be on that label. They also have to mention the specific type of shellfish, fish, or tree nut. So they would have to say shrimp for one of the crustacean shellfish or walnut or almond as the tree nut. So labeling has gotten easier from that perspective. There are some nuances, though, that you have to be aware of when you're shopping, and that also has to do not only with the things that aren't covered that I already mentioned, but something called advisory labeling. Another word for that would be like may contain labeling. So you'll see a lot of products these days, a lot of them actually, that may say may contain peanut or processed in a facility that also processes milk or any of those types of warnings. Right now, that's not part of any regulation. So what you have to be aware of as a parent shopping for your child is that when you see those labels, it is a warning sign. It's a red flag that this could be contaminated. Really, talk to your allergist about exactly what's right for your child, but my bottom line now would be to avoid the foods with the advisory labels as well. Well, if your child accidentally ate an allergen to which you're avoiding and you know that they ate it, you have to be prepared for an allergic reaction. And an allergic reaction can be anything from mild to severe. So I'd start off by saying make sure you talk with your doctor ahead of time to discuss this potential eventuality. If your child has a potentially severe allergy, a potentially life-threatening allergy, then your doctor, typically an allergist, should have prescribed an emergency care plan or an emergency action plan so that you know what to do in case something like that happened. This is typically a plan that includes self-injectable epinephrine. Epinephrine is the medication that reverses the severe symptoms of a reaction and basically gives you time to get to an emergency room, for example, by calling 911, because even if the shot of adrenaline, of epinephrine, reverses the symptoms, then sometimes they could come back and you'd need to get to an emergency room to be watched for several hours. We often say at least 4 hours to make sure that the symptoms really are gone and aren't coming back. Well, an allergic reaction can include symptoms that are anything from mild to severe, but it could include skin symptoms like itchy skin, skin rashes, hives that look like mosquito bites. It can include flaring of rashes that are already there, like eczema rashes. It could include stomach problems like pain, vomiting, or diarrhea. It can include breathing problems like trouble speaking, hoarseness, feeling of the throat tightening, trouble breathing with air going in and out becomes difficult, asthma-type symptoms like wheezing and coughing, and just a feeling of difficulty getting breath. It could also include heart circulation problems, and those would be feeling faint or passing out or losing consciousness, having poor pulses if you're checking someone's pulse, them looking pale, or sometimes actually they look sort of discolored red or even blue. And there could be a feeling of impending doom. Sometimes reactions start with milder symptoms like the feeling of something tingling in the mouth or an itchiness, and then could progress to more severe symptoms as the ones I've mentioned. Anaphylaxis is a severe allergic reaction that is pretty rapid in onset, includes some of these severe symptoms I mentioned, and can be fatal. Part of the symptoms can include swelling of the lips, face, tongue, throat, or other parts of the body. And again, the progression isn't always predictable. Sometimes it's rare, but people may have every symptom but a skin symptom. And that's actually important to recognize, because if you have someone who you believe is having an allergic reaction, you might say, well, gee, do I see hives? And it turns out that there have been fatalities where there weren't skin symptoms, there were just a lot of the other symptoms that I mentioned, and yet a progression to a severe reaction without the hives. So people with food allergies have to also be aware that that can be a circumstance, and you still should treat with the right medications. But one of the food-specific type of therapies that is being researched most vigorously right now is something that we call oral immunotherapy. And there's another version of it called sublingual. But what that means is that the food that you're allergic to is being given in very tiny and gradually increasing amounts over weeks and months, either straight into the mouth and swallowed or sometimes under the tongue. And so these therapies, which are currently experimental, so far in some of the preliminary sort of pilot studies, the beginning studies on these, show promise, because some of the people who are undergoing this therapy are able to gradually get up to amounts of the food, let's say milk, that would be beyond what you might come across in an accidental exposure. And actually, for some people, is to the level that's essentially meal-sized amounts of the food. So it's very exciting to try to progress people through this, but there are a few caveats. We can sometimes, for some people, push these small amounts and gradually increase to these large amounts, but not everybody tolerates that. And certainly even the people who seem to tolerate it and the people who just end up not being able to have reactions along the way. So while you're trying to give them this treatment, some people will have allergic reactions to the therapy itself. We also don't know yet who this is going to work for best, what level of protection they might get, and also, very importantly, whether we're sort of pushing something into the body that sort of gets to a level where they're able to be protected to a certain amount, but what would happen, for example, if they stopped the daily treatment? So you're pushing to a point where you're getting the food you're allergic to almost as a medicine. So we have to figure out who has a permanent treatment, a cure, and who is just protected while they're on the treatment, and who has to watch out for the various side effects while they're on the treatment. So this is not ready for prime time yet, but it's very encouraging what we're seeing. And my main message in the end on this is not to try this at home. Let's watch for the final results of the studies. If your child's been diagnosed with a food allergy, you need to talk to your doctor about a few key things. One is keeping them away from the food that they're allergic to. And there's a lot about that, but one of them is learning how to read labels and understanding the labeling laws. Secondly, when your child is avoiding the food, well, there could be an accident. And so you have to have an emergency action plan, which for someone with a life-threatening food allergy includes knowing how and when to use the key medicine, which is self-injectable epinephrine. And although right now the treatment is avoid it and be ready to treat in case there's a reaction, we're hopeful that a lot of the studies that are going on these days, which include various trials of trying to desensitize someone to the food, maybe that will be a rescue down the road that we're hopeful for.